So moving on, diagnostic workup, super important. You've seen these slides, during the accident, whether you get injury, soft tissue injury to facet joints, or you really have a disruption of the capsules that, on the neutral position, it may kind of go back and not show that instability. So it's super important to get bending X-rays. It's super, super important. When I did my fellowship back in 2003-4, everyone gets a bending X-ray. The reason is you want to make sure you don't have instability. Neutral position, things may look fine. MRI, patient's lying down, even standing. But when they bend forward, and you can see this patient here, now how much they have to bend forward and backwards, things move. You can see here, like the X-ray, it looks fine. The minute, a little bit of listhesis, but as soon as they bend forward, it really moves. They went to the left, just standing, it's fine. It looks like a normal disc. As soon as they bend forward, it's really moving. That's unstable. Here, this is a patient, supine MRI. You got a little bit of listhesis, but look what happens when this patient stands up. The weight of the patient pulls this thing forward so much that it's really drastic. So, this is a patient. You're going to see more and more people having disc replacements. And when you get into car accidents or any sort of trauma, a neutral X-ray is not going to show you the pathology, what's going on. This patient saw me, myelopathic, getting worse, and I was amazed. After a couple of years going from one doctor to another, no one had done a bending X-ray. And when I got the X-ray to the right, it just, again, pictures speak 1,000 words. You can see it's completely unstable. Look at the posterior facet joints, how it's splayed open. This disc is dislocating. So I had to do a 3-level fusion to stabilize it. You're muted, Jeremy.
Important information. I didn't want to interrupt you, but how often do you see, because most of us, when we look at our average spine cases, we think about the MRIs. And, I see doctors doing, like chiropractors will do X-rays early on. What percentage of the X-rays that you're seeing come in are done properly, like flexion X-rays? And how do we know to ask for that or say that, or how does it come up?
Yeah, very few percentage. I would say less than 5% are done correctly. So please, if they're chiropractors on this call, if you know them, please tell them to get the bending X-rays, because we don't want to repeat them. I hate to kind of waste resources and send the patient back for more radiation, but I need those bending X-rays because it's not a proper workup. It was I believe 7 years ago, there was a young lady I saw, nobody could figure out what's going on with her. A lot of neck pain issues, and she's had a bunch of treatments. All I did was a bending X-ray, and you could see the facet joint splaying open. So I had to do a fusion on her, and she got better right away. So it's super important.